Earlier this week, health officials revealed that members of the local Latino community are testing positive for COVID-19 5 times more than the non-Latino community. Healthcare workers hope a bilingual testing site will encourage more people in the Latino community to get tested. Martin Gutierrez with Catholic Charities is joining us now to talk about this issue and what can be done to help solve it. Martin, thank you so much for joining us this morning.
Good morning. Thank you.
Yeah, why don't you discuss a little bit about why you think we're seeing these high rates of infections in the Latino community?
I think there are a lot of similarities with the general population, but there's one thing that I truly believe is an important factor to recognize. Many of our members of our community, immigrant community in our country, and New Orleans is not different, have to go to work in order to survive. They are not qualified. They don't qualify for any type of government assistance. The stimulus package did not apply to them. They do not qualify for food stamps. So in order to keep going and meet their responsibilities, they have to go to work. So that's a concern. You know, they having to go to work, expose themselves, and also come back home. So I think that's a big factor. Everything else, I think, for the general population is dealing with applies to the immigrant community as well.
Sure.
So we have to recognize that there's a myth out there that immigrants, have access to all these government benefits, and they don't. A lot of immigrants do not, especially the undocumented.
Sure. I've also seen some other experts talk about how Latino community may be more likely to live in a multi-generational household, so they're exposing more people to the virus when they're coming home from work.
That is correct. Yeah, they seem to, we seem to live more closely. Family stays together. We have intergenerational families, grandparents, parents, children, grandchildren, all living together. So yeah, that's also a factor.
Sure. And then I also understand for some immigrants who are not documented, there's a deportation fear. If they think they're sick, they don't want to go to a testing site. They're afraid they might get deported.
Yeah, and that's something that we deal with every single day, even before this crisis.
Right.
There are always these barriers that immigrants have to face. So if life can be difficult for the average U.S. citizen, imagine someone who's dealing with an immigration status that is not regular, a language barrier and a cultural barrier. So life can be very difficult for the immigrants, yes.
Sure. And so part of the solution to this is that there has been a testing site set up at St. Anthony of Padua, which offers bilingual services in trying to encourage more people to come out and get tested.
Definitely. There are 2 sites going on that I'm aware of today. One is at the Clearview Mall in Metairie, and I was out there yesterday, and the lines weren't that long. And the other one is at St. Anthony of Padua on Canal Street.
Yeah, and so what else do you think needs to be happening here? I know Catholic Charities works with the immigrant community when the pandemic's not going on. What specifically can be done now since we're seeing this high rate of infection in the Latino community?
I think we actually have to continue to provide more education in general, but specifically directed to the immigrant community, the use of PPEs, the use of the mask, making sure that they keep washing their hands, making sure if you are at work that your employer provides what's necessary in order to maintain yourself safe and maintain others safe. So we need to continue to educate and continue to press that issue of how important it is to wear the mask, to wash your hands, and to be responsible, not so much for yourself, but for the others.
Sure, this disease is certainly impacting everyone, this virus, but it's impacting different communities differently. So Martin, thank you so much for joining us to talk about how it's impacting the Latino community and what you think can be done about that.
Thank you. God bless you.